Are you comfortable? Good. We're just making sure everything is set up properly as... Let's see here. This is a first treatment of a tattoo removal. Is that correct? Okay. Okay. I think we have everything properly managed here. Excuse me. Too many doctors' signatures basically means none of us can read. But my name is Dr. Karuna Satori, and I will be doing, I see, your first session of tattoo removal on your... May I? I won't be touching you just yet, but I am going to get a little close to you, okay? Okay. Right in this area right here? Right just below? Okay. I see. So this is a color tattoo, meaning we're going to have to use the blue light laser. Red light is absorbed quicker by darker tattoos. Darker tattoos are easier to remove. Colorful tattoos are a lot, not a lot, but a few more sessions. If your tattoo was blacklight or UV, multicolor, etc., it would pretty much be ineffective to attempt any laser on the tattoo. Luckily, judging by the area that it's in, it's on a thin area of skin, meaning it can be removed with a, probably to start, we'll do a 3 in intensity and the highest hurts. So with that being said, let's just go over your chart here. Can you verify your name for me? Date of birth. We're going to get a blood pressure on you and a heart rate, as this does not feel the best. It's nothing like the tattoo that you got, but it is similar to kind of a rubber band snapping back and forth on your skin, as it is a laser, so it's technically burning the skin. But just to relieve some anxiety, tattoo laser removal is the most effective and safest treatment on the market today, and has been for over 10 years now. So nothing to be worried about. We will be numbing the area prior to use. I do have a set of protective glasses beside you there, and I will have a pair as well. Basically, here in a moment, when I check your blood pressure and heart rate, I'm going to apply the numbing cream. We're going to let it set for a while I just kind of assess the tattoo. I'll get the pen set up and start the session. Afterwards, I will apply a damage remedy cream. I'll also be sending you home with a sample, but we do sell full bottles up front at our desk. And that's it. You will come back for your second, third, fourth, depending on when I assess the tattoo fully. But looking at it now, you will probably need about 15 to 16 sessions. Our office offers packages. There's nothing to worry about price-wise. It's a lot simpler than people make it out to be. When it comes to tattoo removal, it's the most, in my opinion, hardest part. The most hard part about getting a tattoo removed is calling and making the appointment. So, any change in medications? Judging by the chart here. Okay. Any new allergies I should be aware of? Okay. And I think that should be it as soon as we get blood pressure and heart rate. So let me just go ahead and set this down here. Okay. I'm just going to get my chair a little closer. There we go. Okay. Okay, so I'm just going to put this on your chest and once on your back, okay? Just follow my lead. Deep breath. Exhale. Deep breath. Exhale. Get around your back here. Deep breath. Exhale. Good. Okay. All seems well in that respect. Let's go ahead and get a blood pressure on you. Rain's really coming down out there. Perfect day to be inside and relax. I used to find going to the doctors very relaxing, as I really enjoyed the stethoscope and the blood pressure. It was actually my favorite part. I'm going to go ahead and get your right arm. Go ahead and just slip that through for me. Very good. Bumped me up there. My apologies. Okay, let's just get a pressure. Ready? Okay, perfect. So we can slip that out. Excellent. So, blood pressure is in range and heartbeat was a little fast, but being your first time for a removal, I can definitely see the anxiety. No problem. I promise you this procedure is safe. I'm sure when I mentioned pain, that kind of threw you off a little bit. Throws everybody off, but I do not sugarcoat. But overall, you will be happy once the tattoo is fully gone. But I will say a tattoo is never fully gone. It is just simply suppressed, if you will. Okay. So, temp's good, everything. Speaking of temp, let's get a quick one on you. I'll write the results down and we'll numb you. Okay, just a quick across the forehead. Ready? Okay, one more time. Good. Okay. Patient appears completely. Okay, so from here on out, no more paperwork. We pretty much begin the procedure now. I will be applying gloves upon using the pen. So let's start with just grabbing a cotton pad and numbing the area. It's pretty much a lidocaine type solution. We do have it in a spray bottle, just forewarning. But the damage repair, which contains hyaluronic acid, which pretty much puts back healthy, younger skin into the skin, cell regeneration. So spray on the cotton pad. And again, we are just going to fully numb this area at this time. Okay, so I will be touching you. Just a warning. Thank you. Okay. Good. While we let that set, usually I would cover it with a plastic wrap, but the tattoo of the area which I'm about to examine now is rather small, so the pain level, intensity level, it will just be a little bit irritating, but again, the lidocaine should numb it for the most part. It's a little bit afterwards, it kind of feels like a sunburn that people kind of find obviously problematic. They have to go to work. If you're getting a tattoo removal on your hand, those who have underlying arthritis or carpal tunnel find that it is brought to the surface and it is very painful. But again, this is in an area that if you wear Under Armour or just underclothes such as a bra or things of that nature, you know how a strap would ultimately irritate you if it was twisted. That's kind of how it feels. It really is nothing to be worried about. Again, I'm just trying to calm your anxiety and let you know that this is safe. The only thing that can be dangerous is if you do not wear your protective goggles, so please put those on upon beginning the treatment. I will remind you. So what I'm going to do now is just examine the area of the tattoo. I have a bright light here, and the only reason for the bright light, as I can see it clearly visible, just to see how high of the intensity I mentioned. I just gave an estimated guess prior. So, okay, here we go then. Ready? Good. Very good. Okay. Good. Good. Okay. I'm just going to go ahead and press on it a little bit. Good. All right, my dear. So, going to go ahead and get the pen turned on first and apply the gloves. Now, when the pen turns on, we're going to give it a moment just to energize. Okay. Alright, so the pen, this is what it looks like. Again, this is a blue light pen. It might look green because of the light reflecting from the ceiling, but this is a blue light. All I do is I turn on the power button here, set the intensity and the frequency / hertz, and judging by your tattoo, we're going to have to start at probably a 5 or a 6 because it's around the skin that is very thin, and the damage and repercussions if we do a higher intensity, which would be a 1. Usually that would be opposite on most scales, but For example, you would think a 9 would be the highest, a 9 would be the lowest, so we're actually going to start at a 5 or a 6. A 1 would probably be your last treatment, believe it or not. With light frequencies, it's complete opposite. Again, you would ultimately think that a black color would take a longer time to remove because of its dark image. In reality, black absorbs light the most, so it is the quickest and easiest treatment compared to color. Okay, I'm just going to go ahead and hook this up. You're going to hear a and that is just the pen charging. Ready? Okay. Perfect. You might be able to hear it. We're just going to set the frequency. We'll start at a 6 for now. And intensity. Halfway. Okay? So if you would, before we begin, please put on your protective glasses. I wear glasses over the glasses, so it will look a little bit ridiculous for a moment. But better ridiculous than blind. Okay, so I can't see a thing I'm doing. I'm kidding. Okay, so just to get up close, we're just going to start. I'm going to be pressing the button on the side and okay, and that's it. Are you ready? It will get a little bit bright. Here we go. It will not hurt. You are okay. Okay? I promise you. You are completely numb. Here, let's do a little test. How's that feel? Okay. I'm sorry. Usually I am a lot more proper, but everybody's first time is kind of humorous to me just for the specific fact that it really is not as bad as we make it out to be. Are we ready? Here we go. Okay. Again. Okay. Good. Okay, just going to go ahead and remove these glasses. Okay. Just check. Okay, make sure everything is brilliant. Okay. So with that being said, just take this up to a 9, lowest frequency, intensity at a 1, and we're just gonna go back over. You can take off your I would rather actually you keep them on. I no longer need them. I'm just gonna go over very quickly of the area and make sure that we've gotten everything around the tattoo. Ready? Okay. Excellent. You are finished. simple. And so immediately I'm going to be removing my left hand glove as I'm going to be applying this damage remedy, which will apply hyaluronic acid for skin renewal, basically covering up the area we just removed, which is much better than just letting it heal naturally with like something like Neosporin. That is completely way out of the question. So many go home and they say, I can't afford the gel. We always give a sample of gel that ultimately lasts up until the next treatment and so on and so forth. But they think, oh, I can just throw some Neosporin on it. You can't. It's not good for you. It will scar and your skin will have a patch of skin that will be brighter. And unless covered up by a new tattoo, will not look very good if you are concerned with aesthetic value. So, just go ahead and a dab will do you. How are you feeling? I understand. Here. Let's see. Your heart's beating a little fast. But it's all over. Okay? Why don't you take a couple deep breaths with me? Keep it up. You're all done. You, my dear, did very well. I'm very proud of you. Usually everybody's first time is a lot more anxiety-inducing. I'm very proud of how calm you were and that you put your trust in me. Thank you very much for that. That was your first session, so this is all that it entails. The next time, we'll just verify your name and address for insurance purposes and date of birth. Get a temp on you again. Same procedure as last time, only the frequency will be a little bit higher, but it will be a lot quicker. If you have multiple tattoos hidden that I'm not aware of, that can be taken away too, if wanted. And being the office that we are, we can also remove skin tags and things like that. That is what, forgive me, these lasers are for. Acne at a very low frequency. Blue light pens are mainly the lower frequencies for things like that, while a red light pen is a lot higher and it's more of a stitching sound, like stitch, 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 stitch. While this is a beep, 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 beep. The beep is just basically it heating up milliseconds. It's the science with this technology is crazy. I don't even understand all of it. I just do the work. But with that being said, thank you so much for coming into my office. You can check out with my assistant up front and schedule for 2 weeks from now. After the next few treatments, again, this can go up to about 16 of them. Please speak with my assistant in regards to packages. We can work with any financial, just patting down to make sure it's cool, and it is. Everything is going as planned. But anyway, find out about packages that will suit your needs, and I hope to see you again soon, okay? It was nice meeting you, and I will see you next time. Good night.